Welcome back to Healthy Living. We're here now for our second segment with Dr. Stefan Sicinschi. He is a cardiology specialist with St. Tammany Health System. So thank you for making time to come today.
Well, thanks for having me.
So let's talk a little bit about you because you're relatively new to the practice. So tell people who are watching, our viewers, a little bit about your background and about what you love about what you do.
Sure. So I'm from New Orleans. I went to college at University of New Orleans. Afterwards, I did my medical training at LSU, School of Medicine in New Orleans, and then I briefly did my training in Shreveport, where I went for residency in cardiology fellowship. And afterwards, I'm returning to practice on the North Shore. And I'm very happy to have joined St. Tammany Health System. Now, originally I was born in Eastern Europe in Moldova, so I do speak Romanian as well. I came here with my parents at a young age and kind of grew up in the New Orleans area from about age 9 or 10 or so. So if there's any Romanian-speaking patients, I'd love to see them as well.
Yes.
I'm bilingual.
That's good to know. That is good to know. And it's nice that you're back in your home region, your second home New Orleans region.
Correct,
so we're glad to
yes.
have you. So tell us a little bit, a cardiology specialist. Tell me about tell us and the viewers, what do you focus on as a cardiology specialist?
Yeah, so I practice general cardiology, so I see patients in clinic, I see patients in the hospital, I perform procedures such as diagnostic catheterization or transesophageal echoes, and I also read echocardiography and vascular ultrasound, and also any sort of stress testing, whether it's an exercise stress test or nuclear stress testing. So we have a lot of different options for our patients in clinic, and depending on what kind of condition you have, we order the appropriate test. And we're able to evaluate more than just the heart. We kind of evaluate the entire cardiovascular system. So I'd like to emphasize that we also do vascular testing. So renal artery stenosis that can give you unexplained high blood pressure. If you have pain in the legs, we're able to look for any sort of blockages in the peripheral arteries. If you have strokes or mini strokes, we can look for any blockages in the neck arteries, because if you have cholesterol plaque in these arteries, it can give you strokes or mini strokes. So it's a good idea sometimes to even preventively evaluate those arteries. For example, I listen for bruits in all my patients, and if I hear any sort of abnormality, then we order an ultrasound to make sure we catch any sort of these blockages ahead of time.
So stress, the importance of the whole cardiovascular system is obviously connected. So tell people that are watching, what is the importance of being aware of that connection?
Sure. So it's important to do kind of preventive healthcare and preventive screening. So I encourage patients to actually come see me before they start having problems, kind of sort of like a screening visit.
To get a baseline, sort of?
Correct. We can evaluate the cholesterol, we can check for any sort of early problems that could lead to plaque buildup over time. And also, if you have any sort of issues, then we can investigate further with kind of an array of tests that we have.
So speaking of sort of that preventative step, what can you do just in your everyday life to keep your heart and your cardiovascular system healthy as a whole? What are some lifestyle things that you would recommend?
Yeah, so I encourage, I go by the American Heart Association guidelines, 150 minutes of aerobic exercise per week. And that can come from, you can have 1 or 2 serious workout intense sessions that get you to that 150 minutes, or you can just go for 30-minute walks every day. You want to get your heart rate up to 100 beats per minute or more when you go on these walks in order to get these aerobic exercise benefits.
Right.
And one thing that patients can do is get these smartwatches, such as the one you're wearing.
Okay.
It looks at your heart rate, and they also count the minutes that that are meaningful exercise minutes. And it's a great way to kind of keep yourself in check whether this week you've done enough exercise or not. The other brand that is good at doing that is Fitbit as well.
Okay. So what have you seen since you've been with St. Tammany Health System as far as the way the cardiology is practiced at our cardiovascular clinic?
Well, a lot of advances have come, recently with imaging, which is great because patients don't need to undergo invasive testing as much as they did in the past. One new technology we've seen in practice is cardiac CT. Cardiac CT is great because it can give us information about the blood flow to the arteries supplying the heart, and we can find a lot of information now just by doing a CT without having to take the patient to the cath lab and do a procedure which carries risks.
Right.
So it's great because imaging is getting more advanced, and we're able to identify disease earlier and do steps to treat it, before patients come in with a heart attack.
And we were talking earlier, you were saying that when a patient comes into our clinics, they see the same doctor, pretty much.
Yes, so one of the benefits of the St. Tammany model, which is different from other institutions, is that you get to follow your patients, or the doctor follows you as you are admitted to the hospital. So for example, I see my own patients in the hospital, and the benefit of that is that if I see you as a patient, for example, I know you, I know that you've had an echo done or an ultrasound done recently. So when you're admitted and I'm consulted on your case, I'm not going to order unnecessary tests, and you're not going to have extra bills because you've had an ultrasound a month ago and it was normal. So if you go in other big academic centers, you usually are seen by a bunch of different doctors that don't know you, and that leads to unnecessary testing in my experience. But if you come to St. Tammany and you follow up with your, not just me as a cardiologist, but your gastroenterologist, or if you follow with your primary care physician, then you have this continuity of care. So it's easier when you're admitted into the hospital to take care of you and do less unnecessary tests.
So it's a very good relationship building model, it sounds like.
Correct.
Is there anything else you want to add before we go? Talk to our viewers about, tell them anything about your practice or yourself before we wrap up.
Not just my focus is on preventive care. I'd rather, it's better to catch the disease early before it becomes a problem. And we have a lot of technology available at our fingertips, and it's a shame if it doesn't get put to use and we get the maximal benefit out of it, which is why I encourage everyone to make an appointment with your local cardiologist so you can get checked out.
Okay, well, thank you so much, Dr. Sicinschi. And we will be right back with Dr. Kavor, our interventional cardiologist.